Those are the prompts. Or actually where you are in the world. Right.
I can go ahead and start.
Oh, we're gonna have you put it in the chat. So this will be chat and talking, but we're gonna give you like probably an overview of the program and some grounding things, and then we'll open it up for questions, and some of our residents will be joining as well. So we're gonna make the most of all of the things by having you sound off and kind of check in the chat, and then we'll give you our remarks and then open it up for questions. All right, Dr. Lucker, do you want to pull up our
I will also unmute myself as I pull up that presentation. Oh, this is great. I'm so glad all of you are here. Okay.
So welcome to all. If you want to just the slide presenter mode, or that's great. Awesome. So this is the OBGYN open house, OBGYN residency open house for 2026. We hold these online virtual open house just because, uh, at the beginning of the application cycle, there are a couple of good things that came out of the pandemic, and there was lots of loss, lots of things that were really awful. But one thing that I think, collectively learned was that you can get a lot done online and through a virtual environment, still building relationship and connection. And so these open houses, there are some departments and some programs are like, I don't know if it really works. I personally think that it does work very well. It gives you a low barrier to entry, opportunity to just kind of get a feel of a department or ask some questions before you have to spend your money and hit submit. So we're going to hopefully give you a good overview of the program and then let you ask your questions. As I mentioned, I'm Sharice Hamblin. I'm an OBGYN in the department, and I'm also part of the Collaborative in Health Equity. Some orientation to UMass and UMass Memorial and UMass Chan. Where you're applying to school will likely have some
You say
hospital
like really
component
quietly.
and some school component, right? And so, at least for an academic medical center, and sometimes they're
Sorry.
exactly the
I
same
don't just
thing,
so big deal.
and other times they are like two parts. Um, Great, our residents are joining, so that's fabulous. So, the Collaborative Health Equity is a school entity, and I'm a part of that team. And I see Sammy Doxy is a part of that team as well. We have four key pillars: workforce development, capacity building. If you think about this, all of your outreach programs, pipeline programs, things like that. And there are additional pillars that we work through to try to help the school and the hospital achieve its health equity mission. Go on. And I mentioned the mission here, that both entities, because at UMass it is kind of separate by like 1 mile, but there are two distinct institutions which can come up in weird ways, but it's nice for you to get the idea. And both are committed to advancing the health of the community that we serve. And you will see from many programs that you apply to, what's the community where the hospital and the program is, and what are the needs of that community. You can go on. So that team that I mentioned with holding down all of those pillars is this wonderful group of six great people. You can go on. I'm also the medical director of the doula program, and I bring that up to this group because it's something that might be unique to our institution, but across Massachusetts, and there are many other states now where doula support is covered by Medicaid. This is part of a national push for advancing and improving maternal health. So a doula is a non-clinical support person who provides emotional, educational, and physical support. Our program here specifically is looking at trying to improve our outcomes and experiences in Black birthing people. It's not exclusive to Black people, just like disparities are not exclusive to Black people. However, that is our focus in particular, and it works in the backdrop of that Massachusetts Medicaid covers doula support. So we have, you can go on. We have a team, so Mass Health covers doula support. We have a small internal team that helps patients find that connection to community doulas. And so our program is kind of like you have doula support plus because you use the institutional resources like social work consultation and interpreter services and other things that we know from internally and leverage those for the benefit of the patient and for the community doula that's working in partnership with us. Keep going. So we have over the 3 short years that I've been here, recruited this wonderful group, and there are more doulas than this, but these are folks who are in the community. Some are from here, born and raised. Others had been new to doula work, and some or like doing this work, but not, they have to go out and find their own patients. And so different levels of connectedness with this group of wonderful individuals who serve our community. And you can see that the languages that are spoken are, vast and broad. And it's more than what we could ever do by even with great recruiting of residents. We can go on. So I'll put the link in the chat, just the doula. If you even just search UMass doula program, you would probably find the same web page and a form that patients can fill out requesting doula support. And then our coordinators who are employees of the hospital reach out to find out some more about the patient and help with some matchmaking with doulas in the community and then provide that wraparound support that I mentioned.
There we go. Now I can unmute. Okay, thanks, Dr. Hamblin. Welcome to everybody. I'm so excited that you all are here. I want to tell you a little bit about our program here at UMass and give you an idea of what we're all about. I'm having trouble going back to the previous slide, but it just is introducing you to our residency team. I'm Liz Alaco. I'm the program director. I'm a generalist. We have Kelsey Shabbat, also a generalist, as our associate program director. We're really fortunate to have an education coordinator consultant here, Dr. Ty Fraga, who's really concentrated on our resident curriculum. And then Shirley Prevel, who's somewhere also here on the Zoom, is our fearless coordinator, who also is a doula in our doula program. We are in Worcester, Massachusetts. If you've never been to Massachusetts, it's really right in the center in sort of the middle third of the state. We are an academic center. We're a tertiary care center. We really concentrate in our program on training generalist physicians and getting people ready for fellowship if they want to be, but we pride ourselves in providing a very well-rounded education to people and developing a lot of interdisciplinary relationships. So working with the doulas is just one example of that. We do have quite a diverse patient population and take care of a lot of patients marginalized in one way or another. And so learning to work with a lens of advocacy and anti-racism is very important to us, and I think is so important. And there are lots of opportunities for that in OBGYN. And we also concentrate in providing some mentorship to our residents while they're here to get you ready for practice once you graduate. Just a quick overview of our clinical sites here. All of our sites are pretty close together. Our main site is the Blue Star in the middle. That's our UMass Memorial Hospital, where probably 85 to 90% of the time is spent. This is where our labor and delivery and GYN operating rooms are. We have a couple of other nearby locations. There's the medical school down the road, a mile away. Like Dr. Hamlin mentioned, these are two different sites, but we work together, and our residents have all the advantages of the medical school, all of the resources that are available, and do spend just a little bit of time rotating in the ED at the university campus. We go up the street to our surgical center at Hanneman for some minor cases. Our residents also rotate at Planned Parenthood The Planned Parenthood in Worcester is a site where we go for family planning. And also, there's a little bit of family planning activity on some of the other rotations. We have for a long time rotated at St. Vincent's Hospital, which is just here also in Worcester. However, our residency is going to be switching to do rotation at Milford, which is maybe 30, 40 minutes away. It's a community hospital where we have a lot of our folks going to operate on GYN. So there's a GYN operating room rotation in the third year out at Milford, which is a great way to experience something still within the big UMass system, but a completely different setting than the academic center in Worcester. Everything's pretty close. Most people live in Worcester. It's pretty easy to get around. There are parking lots. Not everything is street parking, which was a big deal for me as I hate parallel parking. You don't have to parallel park very often here. Our clinical rotations and structure, just generally that we have 6 residents per year, and we have 12 blocks of about 5 to 6 weeks each during the year. We do use a night float system and have call on the weekends. I think some of the overview highlights of the clinical curriculum are that we have an immersion block at the beginning of your first year to get you used to all the major services. That's been really useful for the interns and really popular. We try to get people exposure to the subspecialties early because we want you to know about the subspecialties for being a generalist, obviously, but then also if you're interested in them and want to do fellowship, we want you to have that exposure early. We do have a swing rotation for backup, which is very helpful for coverage for vacations or unexpected absences and gives the residents a little bit more flexibility in things like attending conferences or being able to use their personal days. We have an elective that's in the third year where residents might do an away rotation or do some research, do some extra surgery. Uh, some of them have projects that they've been working on for a long time and invest some time in that during their elective as well. So overall, we try to hit all of the major rotations and subspecialties in a reasonable time frame and come back to them when you're a senior resident as well. Our OB service is busy. We do about 1,500 deliveries per year. We do have a level 3 NICU, so we deliver most babies. There are very few babies we can't take care of, but we have the full range of preterm and high risk pregnancies here at UMass. We do have an antepartum service for people admitted for some complications before delivery. And we're a referral center, so we get a lot of people sent in from other smaller locations in the Central Mass region. We have a team helping out in triage and postpartum rounding. And overall, I'd say the residents get an excellent obstetric experience. We have a lot of specialty outpatient clinics for people with various high risk issues, fetal anomalies, diabetes in pregnancy, substance use disorders in pregnancy. And we have good extra support, sort of, thinking about all of the extra resources that people need in their lives and their health care and OBGYN care. We try to access the resources in the community, and UMass provides quite a bit of support for people as well. So we're able to help people with many different issues like housing and food and other resource access, which is very important to us in general, and I think a big part of the support that people need at this time in their lives. We do have an MFM fellowship here that fellows work pretty closely with the residents, and in general, they complement each other pretty well. There's not tension between what the fellow gets to do and what the resident gets to do, because there is more than enough obstetric activity for everybody. On our GYN service, we have several services that are running at the same time and getting people into the operating room often and early. And I should say people also get into the operating room quite early on their OB rotation. I think all of the interns have done several C-sections by now. So you get to do a lot pretty early. We have a great complement of open vaginal and robotic surgery with generalist attending, minimally invasive gynecologic surgery attending, and then our GYN, Urogyn, and REI attendings as well. We have some extra help managing floor and consults, but residents learn to do that as well, scattered throughout their time on GYN. Some specialty clinics to get experience with colposcopy and LEEP, and a lot of education around pre-op and post-op care. There is some great ultrasound education in REI, and all of our residents come out of residency with the option to be ready to go to get certified in robotic surgery if that's something you're interested in. I just want to highlight our family planning division, as our family planning faculty do a lot of work to get good education for our residents. We are a Ryan program. We are an opt-out program. Our residents do rotate at Planned Parenthood, where they get a lot of experience with counseling, procedural and medication management for abortion, and then also some operating room time at the hospital for some more complex cases. We're very fortunate in Massachusetts to have a lot of legal protection and to be able to offer these services to our patients. Resident Continuity Clinic is part of most of our rotations. Residents provide routine OB and GYN care, urgent GYN care, and are grouped by level in their clinic sessions. So the PGY2s who are on rotations who have clinic will all have clinic at the same time, which is a nice time to see your classmates and also helps with doing some education in clinic because everything can kind of be set to the level that people are at that point in time. We do some condensed ambulatory education in a rotation in the intern year too to get your feet set in clinic. This is a picture actually of our old clinic space. We moved about a month and a half ago to a new space that is, it's actually lovely. Dr. Hamblin is there in one of the rooms right now. It's a really nice space right next to the faculty clinic, meant to make the clinic a little bit more cohesive and in interest of serving patients equitably and not perpetuating the historic division between resident clinics and faculty clinics that kind of fell along insurance lines or lines of race and ethnicity. So that's something we've been working on in the past few years and just recently made the space change. Our didactic curriculum is a real point of pride and something we invest a lot of time in. We have our protected time on Wednesdays, and it truly is protected. The residents don't need to be doing clinical care during that time. We have a great Grand Round series with speakers inside of UMass and outside. And then from 8:30 to 11, our residents have their education time together where they get to do a lot of simulation, interactive learning, lecture. Things are designed so that the information that people learn from one week is sort of consolidated with doing questions together the next week. We have journal clubs during this time and use it for some research presentations. Our residents do presentations for their research projects at the end of the third year. And then also there's a little bit of protected administrative time to complete the vast amount of paperwork that you have to do as a resident. And also some time to chat with myself and our chair so that we can give residents updates and they can give us updates on how things are going on the services. So we're able to do the debriefs 1 to 2 times a month and have that time set aside to talk. Advocacy and health equity is really important to us, and you've heard that several times at this point. Dr. Hamblin introduced the Collaborative for Health Equity, which is a fantastic resource for the entire medical school. But we are lucky to have Dr. Hamblin and Dr. Johnson and Bakwu in our department to provide some extra focus on OBGYN. Dr. Hamblin talked a little bit about our doula program, which I think is a great example of using our medical school and medical center resources and partnering with community doulas and then investing in the clinical care and getting the residents also training and working with different providers in labor and delivery. Inclusive naming in clinical practice is something we've been working on recently. We just announced actually that we're changing the name of the maternity center to the birth center to be more inclusive. And there's currently ongoing committee work to rename our continuity clinic because it has been community women's care, which is not a very inclusive name. So that is sort of a project in motion at this point. And then our residents have a great opportunity to do advocacy at state and national level. So there's a picture of a group of our residents and fellows at the Congressional Leadership Conference in DC. We're always able to send people to DC for that conference. We send people to our state days. There's advocacy sprinkled throughout the year as well. So if formal advocacy opportunities are something you're interested in, we're able to get people there. And setting aside that time is really important. This is our class that just graduated. We graduated our 6 residents. In general, our residents tend to split around 60-40 going into generalist practice versus fellowship. This past year, we had one resident go for GYN oncology, one for complex family planning, and the other 4 are going to start work as generalists in the fall. That's pretty typical. Some of our generalists work in a very academic setting, and then many of our generalists work in private practice, but at places where there are learners. So a fair number of our graduates actually work at the private practices here at UMass and continue to work with residents and medical students because it's something that's very important to them. And the residents learn a ton from our private physicians. So I think that reflects a enjoyment of education in general and being in the academic education environment that is true for our residents when they're residents and carries on through their careers. Oh, and this is the residents having fun picking flowers at their team building day. Um, so I just wanted to give you all a very broad overview of our program so that we have time also to answer questions that you might have. But I really appreciate you being here. And I hope that this gives you enough information about us to be interested and maybe think a little bit more about our program. We're always excited to get to know everybody during the application and interview season, and happy to answer whatever questions you might have now. I'm going to stop sharing so we're not just looking at a big blue screen together.
And feel free to just come off of mute and ask your question.
I have a question about fellowships and how you support your residents if they do choose to go through a fellowship and kind of the timeline
Mhm.
when that's expected to be finalized.
We we actually have 4 people interviewing right now, which is super exciting for us. If you think you're interested in fellowship, you'll get to know the faculty, and specifically, we can like set you up to meet certain faculty if you haven't encountered them yet. And then the faculty are really invested in getting you connected with research projects, bringing you to conferences. We have some allowances in our time off policy for education days that allow you to go to a conference for an academic reason or also for um, like a advocacy or recruitment or other related interest reason. But going to conferences is a great way to get to know people for fellowship. And then Dr. Fraga, who's our education consultant, she also has been doing a lot of coaching for people who are interviewing, doing practice interviews. And then we spend a lot of time talking to people about their applications and reading applications um, to help out. And then we have time set aside a lot for interviews for fellowship and also for generalist positions. So no matter what you're doing, you have some time that's kind of protected and doesn't need to be made up necessarily if you are interviewing. And then we just celebrate on Match Day. So I think there's a fair amount of support, and the residents are really good about supporting each other too during the process, which can be a lot of work.
And I'm kind of scrolling up to see where are you coming in from, Jasmine? From Georgia. Okay.
Oh, yay, great.
Awesome, awesome. I also see that some of our residents and faculty have joined on. So if we have any of the UMass folks want to come off of mute and introduce themselves, that'd be great.
Hi, my name is Bianca. I'm a PGY1.
Hi, everyone. My name is Dr. Krista Damsalvaku. I am the director of the Collaborative and Health Equity that you heard Dr. Hamlin speak about, and I am one of the faculty in OBGYN as well. Happy to be here. I wear a number of hats between this medical school and the clinical system, but most importantly, I'm yet another anchor of support for our learners, especially our residents, and really look forward to you know, if you come here, being one of the faculty that really work hard to ensure that our learners are well supported, know that we are approachable, that we are here to be a sounding board and just really help you not just survive but thrive, and really have a fulfilling experience here throughout your training.
I don't think I had the chance to introduce myself. I think I came just before the presentation. So my name is Shirley and I'm the program coordinator it's been 8 years, right, Dr. Laco? And then 18 total at UMass. Yeah.
Shirley is also a doula, and so we were
Yeah.
together over lunchtime because she wears doula hat and kind of private practice of, her own accord, and then with the doula program, and then also with a study that we have. We are one of the sites, one of three sites for a PCORI 5-year study on the community health worker support and advanced practice for remote medical monitoring and impact on mental health and on blood pressure management for postpartum patients. Cheyenne, you have a question?
Yes, I do. Hi. Thank you so much for the invite link. I'm so happy to be here. I'm actually from Worcester, born and raised, so this is a full circle moment being able to hear about this program. I actually had a question. So I am currently studying in Grenada. I'm at St. George's University. And I was just wondering if you guys accept students, international students for the clinical rotations by any chance? For the program that you guys offer?
For fourth year rotations or for applications?
Yeah, for clinical rotations. I know you have a medical school on
Mhm.
on site, so are there additional spots that you guys have for students coming from external universities that are looking to do a clinical rotation at the facility?
I know that formally I'm forgetting the name of the program, but I know that we accept applications through the
Sorry.
program, which either Dr. Hamblin or I'm gonna try and find real quick to tell you.
Yeah. No, this is a great question. So for 30, so many students who are like coming from Caribbean schools have to find sites for their clinical rotations. So we're not a site that does 30 rotations for anyone outside of UMass medical students. For fourth year electives, we accept students coming from different places. So we'll be looking for a fourth year elective. And then for application, we certainly accept applications from students who have come from other places. I think one of our interns is from Edinburgh.
Mhm,
Like her, we match someone from a school that's not in the US. So
mhm. Yeah, we just use the VSLO system for those fourth year applications, and we have a fair number of non-UMass students coming through for sub-Is.
Awesome. Thank you so much for that information. I appreciate it.
Hi, thank you all for taking the time to meet with us. My question is if your program has any residents with kids or if there might be someone who can speak to balancing that, work family lifestyle.
We do. I could probably talk about this for days. Um, we have uh, we have had a couple of residents have children in residency recently. It is not easy, I will say, but we I'm we're very supportive of that. We just sort of try to make the schedule as compatible as possible. If people are having children, and then people who already have children, the same. Like we have a couple of people who have kids who may be around 10 years old in residency right now. And so some of the time off policies like regarding vacation and personal days that can help for things that you might need to do for kids, sick time as well. So we have sort of like built-in time off for that. And then one thing that I think is really lovely about the UMass GME is it's actual our Central Medical School GME does provide some moonlighting pay for people picking up extra calls while a co-resident is out on a parental leave, which I think is not that typical from what I've heard talking to other program directors. So that means that when your co-resident is out for 12 weeks, they don't have to worry about making up calls when they get back because there's no like trade-off or front-loading calls, and the people who are doing extra do get paid to do the extra one, and that can just relieve the burden a little bit. We have there is a daycare at UMass that is at the university campus just down the road, but some of our residents have used that. And that can make things a little bit more straightforward for daycare. Um, but we do have several residents who have either had children during residency or have older kids that were already born by the time that they matched.
I have a quick question. Thanks for this meeting. It's really helpful. I would love if you guys could talk a little bit about how you review applications, maybe talk about what signals mean to you and what things you're looking for in a future applicant. I think that would be really helpful.
Somebody else interrupt me if you want to. Dr. Hamblin and I were talking about signals a little earlier today.
Yeah, I will just share. And then, so I think one of the things I just want to talk about for all of you, you're all going to be applying to more than one residency program. And so I have tried to I've held myself back from saying this like multiple times on this call, but now I'm just going to say it. So one thing is every opportunity that there is to make yourself stand out or be a known entity in a place, like you want to take it. So showing up to this call is like step one. Thank you so much for doing that. Number two, in this, right? I will remember a question that someone asked because you make these little connections. So I know we did the introduction in the chat, but like saying it again, because now we're putting like the face to the name. So then when you ask your question, saying like, hi, thank you for having us here. I'm so and so from this school, and this is what I'd like to know. I think it's just helpful to take, don't miss these small opportunities to, um, like we're all kind of overloaded with information. So like you make it easy to remember you. Specific to signaling and how applications are reviewed, every residency is going to be different. And so you have to ask the specific question. And like Cheyenne asked about, do we have students who are coming from Caribbean schools or international schools? She didn't ask the question of do we match IMGs, but that's a question I answered because I wanted you all to hear it. Right. And I think that's an important thing if you're coming from a school that is a non-US school, that you want to ask it point blank, like, will you consider IMG applicants and have you ever matched, a student? Like, these are real questions that any program should be able to answer for you. Specific to how applications are reviewed, we basically have a small team of maybe 4 people who are reading and reviewing applications to then say, should we interview or not? We have a set number of interview spots and a set days for interviewing. And so, the math is just what it is. And we will review all of the applications at one time, like basically over the course of 1 month. Some residency programs will say like, oh, it's rolling or something like that. Like, you never know. My previous institution, I was in Lancaster, Pennsylvania for 13 years before this, and it was literally one weekend that all of the applications were reviewed, and that was set in stone, and there was really not much room for movement after that. However, there was a conference that we would attend. So you're now meeting students at a conference, and you already given away the interview spots. So, there's some nuance to all of the things. We don't have a policy about signaling, like you don't have to signal us to be granted an interview. And there was we just went over talking about like there are some places where that is, you must. We're not going to even consider it. And I think that some of that has to do with what have they seen in their past what have they seen since signals have been around? You kind of have a 1-year cycle to get feedback on the process that you did, and then either make a change or double down on the process. But I think that making it known if you're very interested in any program is something that's beneficial. If you have done a 4th-year elective in a place, they know that you're interested. I don't know what reason someone would do a 4th-year elective in a place they don't want to go. And most times, if you spent a month somewhere, the program should be able to say whether they want you to be there or not. So I hope that answers your question.
Yeah, thank you.
Hi, I'm a prelim from Florida, so I was wondering if your guys' residents kind of feel like they have a nice work-life balance, because personally, I'm a Gen Surg prelim right now, and it's a little bit hectic, to say the least.
I think there are some rotations where the balance is a little more towards work and some where it's a little more towards life, and that's probably true for most programs. Our residents, I think they get outside the hospital, and they get to spend some time with each other and with family. They really enjoy spending time together outside of the hospital, actually. So they very much make that happen. We've had some changes in the past couple of years in the rotations and like the way things are structured. And we actually expanded our residency recently, and that's given them even a little bit more space. So um, I was like last weekend, many of them went to the beach together. The second year and first year classes usually have dinner together once a week. So they really do make that time to hang out outside of work. There are a couple of rotations. There's some like admin time and wiggle room. So you get to give your brain a little bit of a break and you're not on the labor floor all day. But I think the balance is okay. As much as it can be realistically in residency, you're trying to learn a very broad specialty in 4 years and learn how to operate and feel comfortable. So I won't say it's like not a 40-hour work week, but they do find some balance. Yeah.
Thank you. I'm happy to hear that they have a little bit of balance, because I feel like me and the sun only see each other in passing right now. So
I have seen sunburned residents.
that's good. That's good.
Hey, I'm Chelsea. I'm a 4th-year student at Duke right now. I'm actually doing a visiting rotation at UMass coming up soon. Um,
Great.
my question is, do your residents do any off-service rotations, such as like with the emergency department, for example?
Yeah, they spend some time in their intern year with the emergency department, family medicine, which is an outpatient rotation, and a couple weeks in the ICU as well. Those are our 3 off-service rotations. In the emergency medicine and family medicine, interns also come and spend some time with us on the labor floor, which is really nice because you kind of get to know a few other people in your same year, and you'll encounter them again inevitably when some of them are attendings working at UMass. So those are some nice experiences to kind of round out the OBGYN sort of education. You know, you do have to do primary care in OBGYN, and then you also need to be able to solve some medical mysteries, especially when people are pregnant and they have a mystery going on. So those experiences are pretty nice, and all of them are happening during the intern year.
Thank you.
I'll just piggyback off of Dr. Lacko, the pro tip of thinking about what is the environment that you're going to be in? Like, how many hospitals do you rotate at? What's the proximity of those different hospitals and how much time are you spending in the places? Some small things that were, like Dr. Lacko mentioned, parking, but even like meals and just the different things that are like, you're going to spend time in the hospital. It's going to be the majority of your days. I talked with a mentee the other day, and she's like, I spend more time at the hospital than I spend at home. And I'm like, why do you think they call it residency? And so it's just kind of like, this is a season, it's not forever, right? But it is the reality of it. And so it's like kind of what is that going to look like? Are there spaces that you have that are like for, like, is there a resident lounge? What is it? Maybe just kind of like some of the things of what does it actually look like to be a resident there? And then the other programs that train there. Um, this time of life is kind of it's so unique. And I could definitely say that some of my best friends, were from residency and not even necessarily in my program, but you spend a lot of time in the hospital, you will interact with other residents. And so sometimes you can find your group or your tribe or your people inside of your residency program or even outside of your residency program.
Hi, I'm Emma. I'm a UMass fourth year. Um, Dr. Lacko's comment about doing primary care in OBGYN made me wonder about how like clinic works for residents and whether or not you're sort of like following a patient panel or if you're kind of like sharing the patients with the other residents. So I was wondering if you could speak a little more about that.
It is a little bit more sharing just because of the way that the schedule is, where you have some rotations where you're not in clinic. Like you won't be in clinic when you're on nights or when you're on an off-service rotation. But some of the changes we made over the past couple of years to get the residents of the same year in clinic consistently in the same session during the week help with continuity, because then a patient who's getting prenatal care and has Monday afternoons work the best for them for appointments, you will encounter later in the year because your clinic will be on that Monday afternoon when you get back to clinic. So I think that's been helpful. The residents have worked out some really nice ways to help with continuity, even when they're not seeing the patients again. So the way that they document is very helpful. We have some residents who are in roles where they will provide some backup for reviewing results and talking to patients, for residents who are on super busy rotations or on nights and they aren't able to necessarily follow up on all of the things from their previous rotation. And some rotations are a little bit more clinic heavy, but most of them you might have clinic once a week while you're on that rotation. And some of those specialty clinics also kind of round out the clinic experience. So you get to see some things that are a little bit less common, but in a more concentrated way. So like the diabetes clinic is a great example. You just help people with their diabetes for that session in the morning. So you get the repetition and have guidance from the MFM. And so then, when you're out and about in your practice as an attending and you have a patient who has diabetes, you like have had the familiarity with how to manage that. You do some clinic in the subspecialties as well, and that helps give you an idea of what you might refer somebody, what their experience might be when you refer them. And also, I think, as a resident, you're always precepted by the attending. There's an attending there all the time to help you and see patients with you. But then being in the subspecialty clinics, you get a little bit also of like the attending, how this attending sees their patients too. So a little bit of that like example, but I think in a level appropriate way. So there's a little bit of a mix. And we do have that clinic rotation in the first half of intern year because clinic is something that you have to learn and the things that you need to learn to do clinic are sometimes surprising. So that rotation has a mix of doing your own clinic and also doing some buddy clinic with the senior residents to really understand the flow and the different ways to structure different visits. I think clinic is another place where you learn how to access the resources that we have here at UMass and that we have in the Worcester community. We have many patients who speak a language other than English as their first or preferred language. And so also in clinic, and on the floors, we use the interpreter services quite a bit. And that is also a skill that you learn when you do it often. And so that's also a skill that I think our residents pick up quickly and become very good at, which is great. It helps them take care of more people. Uh, and I see Dr. Hamlin putting in the chat, anybody speaks Brazilian Portuguese, that's one of our more common languages, Haitian Creole, Spanish, I think Vietnamese and Arabic are other top languages too. So there are lots of different skills, lots of different fun things in clinic. And our residents do a lot of procedures in clinic. It's fun.
Great. Thank you so much. That was really helpful.
Hi, everyone. My name is Venice. I'm a fourth year at Philadelphia College of Osteopathic Medicine in Philadelphia. Thank you again for your time. I just have two questions. So for the first one, for letters of recommendations, is there like any preference for, say, like a standard letter of recommendation or like a chair letter, or it doesn't matter? And then the second one is, do residents have the chance to do any global like rotations and opportunities of the sort?
I would say your letter writer doesn't matter. It should be someone who knows you well. And I don't think that you can specify it for your school. So it's like there's always the MSPE, this like your standard letter that comes from your medical school that says, how do you line up across your peers? And sometimes the school has a rank that it's included in that. Other times it is, but they're very unexciting letters, right? Things that catch our attention are, did you get honors in rotations? And then what electives have you done? Like kind of also like, what are your experiences? So all of you were whole people before you started medical school, and some of you will have really continued to do the things that made you you throughout, and other times it might have been like there's less room for some of those extra activities, or not really extra, but they basically your application tells us about who you are, what you've done, and what matters to you. And so as you're putting that together, make sure that it actually says that. It's not necessarily like we want to know about 15 research, things that were chart reviews or that were like not even in the field of interest that you are claiming to have now in your application to OBGYN residency. You want to make sure that you have people who can speak about your work, your why, and why you should be in this field, and what kind of training environment you want to be in, and or that they think that you should be in, right? So there's that. And I'll let somebody else answer global health. With a short answer, I'll say is yes.
Yes, we have a couple of global health experiences that are recurring. We have one of our Eurogynes goes once a year to Rwanda and does some education and also some procedures for fistula care. One of our MFMs had gone as well. She just retired, and I'm not sure if there's another one of the MFMs that's going to be picking up her part, but she did a lot of education there. We have a group often sends people to a site in the Dominican Republic that it's not quite annual, but many years. There are some other global health rotations that people have been on that have been a little bit more self-constructed or self-motivated. There's somebody who went on a research trip in Kenya recently. Um, there was one resident who had her own organization that she had worked in. She went back and did some work on recently. I'm trying to think of what other experiences people have had in the recent months. But yes, you can go. And one of the great benefits of being at a medical school is that there are also many people in other specialties who are doing global health work and have programs that are longstanding. And so that is all accessible. You just have to do a little bit of planning for it. But yeah, it's absolutely possible. The elective during the third year is when most people would do that.
I'd also want to add in, with the collaborative and health equity that I lead, that Dr. Hamlin is also engaged in, we do have a global health arm. It's led by Dr. Anindita Deb, who's also very active in the curricula with the medical school. And we're in the process of building that out because I know there are opportunities where learners could potentially garner funding for research projects. Plus, it's also just a way to get connected to the larger and milieu of clinicians and researchers who are doing global health work. And we have a symposium every year where we have numerous posters from medical students and residents who are actively engaged in research, and they're very much open to other partnerships. In fact, I was in a conversation just yesterday with our nursing colleagues in terms of some of the work that they're doing in Ghana, that they would love to build it out with more robust partnerships with between nursing and our OBGYN colleagues. So I think there's robust opportunity, especially if a learner is very much passionate around global health, to really build that out and get a lot of faculty support along the way. And the other thing I wanted to add in, Worcester is a a diaspora city of migrant communities from all over the world. And a lot of what I've sought to do through the Collaborative and Health Equity is merging, global work is local because we serve a very global community on our doorstep. You heard from Dr. Laco all the number of languages that we hear from our patients speaking to us, with us day to day that we're using interpreter services for. So I've sought to really close that loop in terms of how do we think globally as we are serving global communities in terms of bi-directional ways that global partnerships and global partners and projects and educational venues can have direct impact on the local communities that we serve that are coming from these same regions of the world. So that's some of the stuff that we've sought to really be intentional about in terms of building strong community partnerships that are absolutely globally minded, and really enhance just our consciousness in terms of how not only the work that we do is locally impacting our communities, but have really strong global implications for advancing women's health and maternal health equity globally. So I really think if that's a passion of yours, there's many opportunities to really build and fuel that through just the larger networks that you can have access to through UMass Chin Medical School.
Awesome. Thank you all so much.
Hello, my name is Sophia Oduro. I am a fourth year medical student at Howard University College of Medicine. Um, I was born in Ghana, so I'm really glad, and I'm also very interested in global health. So I'm very glad that came up in conversation. But I also wanted to ask that if there are any opportunities for residents to give feedback, whether positive or some challenges like they constantly face in their training, and how is that feedback, whether positive or challenges, taking into consideration to ensure that they constantly have a advancing learning experience, basically.
Thank you. Great question. Yes, there are many opportunities for feedback. The residents give us a lot of feedback, myself and the chair, when we do these debrief sessions with them during their protected education time. We do get a lot of feedback. then, which I love because it means that their residents are comfortable just talking to us. But they obviously are doing the work of residents and have the best idea of how things are going. And so there are many changes that have come out of that. Sometimes we can change something relatively quickly, and do a little tweak in the schedule. And sometimes it takes another year to be able to get something in motion and make a change that impacts the whole year of scheduling or availability. Residents have the ability to provide anonymous feedback at any point in time. We have a system set up for that. They provide feedback on surveys. All of that is really, really, really important, and helps shape the way our program goes, honestly, more than anything. And so we really take resident feedback, whether it's positive or constructive, to heart and have a lot of support. I think this one thing I love about this program is that there's a lot of support for making changes in the program. And the residents also have a union. The residents have been unionized for several years now. And so if you're thinking like on a bigger level within the institution, the union is also a great resource in promoting some change within the GME community. And I mentioned before that our GME does have some support, financial support for call coverage during parental leave. That's something that came about with the union. And so the union has been quite supportive of things like some educational funding, the time off policies, and is a nice resource for the residents, provides some extra like healthcare and mental health support as well. So there are lots of avenues for that, I think, and certainly the resident feedback has led to many, many, many changes in the program.
Thank you so much, and I appreciate the tangible examples you also gave.
Right. Well, we're coming up on the hour. I hope that you all have gotten your questions answered. If by chance you just joined on a link and you didn't register, we definitely want to be able to keep in touch with you. So if you put your email in the chat if you did register, we have it. I have been kind of cross-checking as we went through. So if you know that you didn't ever give us your email address, and you want us to reach out again, then please put it in the chat, or send it to one of us directly. Um, Thank you for your time. Thank you for being here. Thank you for your questions and your interest in the OBGYN residency program here at UMass.
Thank you all. Good night.
Thank you. Good night. Good to
Thank
see you all
you.
reaching far. This is wonderful.
Thank you so much.
Thank you so
Thank
much.
you. Good to chat again.